are just afraid of this disease. If you know something, help us Zimbabweans. We are on stranded, people that are dying.
During the early stage of the COVID-19 pandemic in Zimbabwe, like elsewhere in the world, little was known about this novel virus, and panic was not uncommon. 2 months after the country confirmed its first coronavirus-related death in March 2020, a Chinese medical team arrived in the country to assist in the fight against the pandemic. Among the 12 team members, Sun Shuang was a traditional Chinese medicine expert specializing in respiratory diseases.
作为队里唯一的中医师，我主要负责中国津巴布韦针灸中心以及抗疫的工作进行进展。
Eddie Senyama is a resident in Harare, capital of Zimbabwe. He and his wife caught COVID-19 in January 2021. As they were experiencing symptoms like headaches, runny nose, and nausea, they approached traditional Chinese medicine for help.
It was a 5-day course, and then on the second day I started feeling much better, and on day 4 I had fully recovered. I feel it's very effective, and it's cheap, and I would recommend that Zimbabweans can take up this medicine. I think it's very effective.
我大概收治了1400多个新冠患者，线上线下，总体的中西结合治疗有效率的话是达到了92%以上的，所以这个也是很有说服力，包括卫生部，包括大众都还是很认可、很接受的。中医药在新冠救治的方面，主要突出的优势，我觉得在于一些全身性的一些症状的一个调理。给药以后，它的这个呼吸道症状和全身症状可以一起同时得到一个缓解，我觉得这个是最大的一个优势。
To help fight the COVID pandemic, China has dispatched traditional Chinese medicine experts to about 30 countries and regions. It has also been sharing the TCM treatment of the coronavirus in more than 150 countries, while providing TCM products to those countries in need.
اسمي داوود. عندما أصبت بكورونا عانيت من بعض الأعراض كالزكام والسعال والحرارة المرتفعة، فدلني أحد الأقارب على الدواء الصيني والمتوفر في الصيدليات، والذي ساعدني على تخطي هذه المراحل، وكان له الأثر الفعال في تخفيف حدة العوارض من حرارة وسعال والكحل.
In a report released in late March, the World Health Organization confirmed that TCMs are beneficial in the treatment of COVID-19, particularly mild to moderate cases. The WHO also said there are promising data to suggest that TCM is beneficial in reducing the risk of progression from mild to moderate cases to severe COVID-19. In Britain, which boasts one of the best health systems in the world based on Western medicine, the traditional Chinese medicines have become increasingly popular. Chen Zanyu, president of Federation of Traditional Chinese Medicine Practitioners, said he and his colleagues have become much busier, especially since the COVID-19 pandemic.
Overall, at least more than, that's what we calculate, more than 10,000 at least. Mm-hmm. Yeah. In fact, probably none of the herbs can deliberately kill or eliminating the virus itself. But the good thing about Chinese approach is we try to readjust the body's immune system or the balance of energy or balance of 5 elements or yin-yang. So that is what the Chinese wisdom we are being practiced for some years.
It caused palpitations in me, but it was like 10 or 15 seconds twice a day. The herbs calmed that down. They just made me feel more balanced and better able to function.
In Germany, to help fight the coronavirus pandemic, in 2020, Confimed Pharmaceutical in Germany and Anhui Jiren Pharmaceutical in China jointly introduced Chinese medicine formula Shufeng Jiedu to German pharmacies. This includes the Rose Pharmacy in Rosheim, Bavaria, Germany.
Und da hat natürlich Shufeng Jiedu auch seinen Platz gefunden, nachdem wir sehr schnell gesehen haben, dass es eine extrem gute Wirkung hat bei der akuten Infektion, bei der hohen viralen Belastung mit Corona.
In its recent report, the WHO encouraged member states to consider the potential use of TCM for the management of COVID-19 in the context of their healthcare systems and regulatory frameworks. From Europe to Africa, that is already happening.
We are inspired by the Health Commission of the People's Republic of China for adopting COVID-19 treatment guidelines that integrate traditional Chinese and conventional medicine. This integration of the two systems of health will undoubtedly contribute to the transition from volume-based to value-based healthcare.
Yes, I think the two should be merged and work together. And it's not just about COVID. There's all sorts of situations where people will benefit. And in fact, the whole society would benefit.
So Chinese medicine can play a more and more bigger role. I remember when I was a student, one of my teachers says, well, obviously lots of people sing them. As long as they are gold, they will shine. I think that's for sure.